3 TV.
There are new non-surgical options for common gynecological issues, and here to tell us about all of them is Dr. Russell Bartels with Scottsdale Center for Women's Health. Always good to see you.
Always good to be here talking about the latest and greatest in women's health.
You were saying there's a lot of new procedures out there. Who's a good candidate for some of these, and what type of symptoms are we helping with?
Well, what I'd like to talk about today is non-surgical options for some of these common gynecologic issues, such as urinary incontinence, which is huge, and that might be leaking when you cough, sneeze, or exercise, and it can also be a little bit of an overactive bladder situation where you always have to get to the bathroom. Also, diminished sexual response can be one of these issues that we want to address, as well as vaginal dryness. So these are common problems, age-old problems, but we have now newer solutions in the form of non-surgical options or non-medical. Instead of using medication, we're using procedures. So who would be a good candidate is anyone who might have those situations bothering them day in, day out, and that could be someone in their 20s, 30s, 40s, and beyond.
Yeah, you're seeing this in all different age groups, but you've got a lot of different options for each of these symptoms. It's kind of really changed your whole industry.
It has. We've gone from, using a surgery like a bladder sling, which has, well, it's surgery, so it has downtime, potential complications, and it doesn't always work that well. And so now we've replaced that with basically 3 options. There's a FemiLift CO2 laser. That's 3 treatments, about 10-15 minutes apiece, wide awake, no pain. There's the O-shot, which we've talked about in the past as well, which is platelet-rich plasma, which we get from you, and we prepare it and inject it into the vagina or the G-spot to enhance sensitivity as well as address bladder issues. And then we have the newest weapon in our arsenal is the Genevieve radio frequency device, which is about a 30-minute, again, painless procedure, wide awake, and it uses radio frequency to heat the tissue in the vagina to really snug the vagina for better sexual sensitivity and really address the bladder issues as well. And so these are all great options for women suffering from these issues who say, it's not bad enough that I need surgery, but I really would like to enhance these issues in my life and not have surgery or use some medications that might be suggested.
Right. What about insurance? Do they cover any of these?
Insurance doesn't typically cover these. Maybe they will in the future. However, I'd point out that a lot of insurance have large copays these days, so even procedures like a bladder sling that might be covered by insurance, you're going to wind up most likely coming out of pocket about the same price as you would for these procedures, or even less for these procedures. And we do offer payment plans too that can really make it very affordable and easy.
And you've got such a long history in this field. You're really a go-to expert. Tell everybody why they should see you.
Well, it's just, over the years, we've always been looking for the next best thing and have incorporated that into our practice to help women with these issues. So I would say that in Arizona, perhaps the Southwest, I've wound up having the most experience in these areas, first with surgical options, and then as we progressed into these newer state-of-the-art techniques, these companies come to me to offer, to my patients, because they know that, myself and my partner, Dr. Webb, are the go-to people for these issues in this area.
Right. And you've got a special offer right now, too, for viewers.
We do. To make it a little bit easier, we're offering $500 off any of our bladder and vaginal rejuvenation procedures for those who take action and call in the next 30 minutes.
All right. Dr. Bartels, thank you so much for being here.
My pleasure.
And if you'd like more information on Scottsdale Center for Women's Health, visit their website, scottsdalewomenshealth.com, or call the number on your screen.